Hello everyone. Today we'll be talking about the Patient Health Questionnaire 9, which is commonly known as the PHQ-9. So what is this PHQ-9? So this easy-to-use patient questionnaire is a self-administered version of the PRIME-MD diagnostic instrument for common mental disorders. The PHQ-9 is the depression module which scores each of the 9 DSM-4 criteria as 0, not at all, to 3 nearly every day, and it has been validated for use in primary care. It is not a screening tool for depression, but it's used to monitor the severity of depression and response to treatment. However, it can be used to make a tentative diagnosis of depression in at-risk populations, for example, those with coronary heart disease or after stroke. When screening for depression, the Patient Health Questionnaire can be used first. It has a 97% sensitivity and a 67% specificity. If this is positive, the PHQ-9 can then be used, which has 61% sensitivity and 94% specificity in adults. So, let's start with the first question. So, I'm going to ask you, over the last 2 weeks, how often have you been bothered by any of the following problems? 1. Little interest or pleasure in doing things. So there's not at all, several, not at all scores 0, several days scores 1, more than half the day scores 2, and nearly every day scores 3. Feeling down, depressed, or hopeless. Not at all, several days, more than half the days, or nearly every day. Then trouble falling or staying asleep or sleeping too much. Not at all, several days, more than half the days, nearly every day. Feeling tired or having little energy. Not at all, several days, more than half the days, or nearly every day. Poor appetite or overeating. Not at all, several days, more than half the days, or nearly every day. Feeling bad about yourself or that you are a failure or have let yourself or your family down. Not at all, several days, more than half the days, or nearly every day. Trouble concentrating on things such as reading the newspaper or watching television. The next one is moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual. Then the next one is thoughts that you'd be better off dead or hurting yourself in some way. So the total score that you get will be out of 27. So when we look at the severity, 0 to 4, none, 5 to 9, mild, 10 to 14 moderate, 15 to 19 moderately severe, and 20 to 27 is severe depression. So well, this is basically a summary of what we have just been talking about. So that's all about the Personal Health Questionnaire 9. If you like the video, please like, subscribe. Thank you.